In 2025, Smith team conducted a national study to assess the level of stigma associated with tuberculosis in Moldova. What did we learn from this study? In addition to the alarming level of self-stigmatization, stigma persists in the community and even within the medical sector. Let's see how stigma manifests in the healthcare system. Perceptions of healthcare workers toward TB patients can sometimes contribute to reinforcing stigma. For instance, 80% of the interviewed doctors believe the treatment should be imposed if necessary. This reflects an authoritarian approach, often motivated by the perception of the disease as a threat to the public health. 74% of participants perceive TB patients as dangerous. This perception can fuel fear and social distancing towards affected individuals. It is important to remember, after starting treatment, a person becomes non-infectious within a short time. For this reason, the World Health Organization promotes person-centered care, which allows patients to choose where they receive their treatment. But what do patients say? Among people who have experienced stigmatization, 50% say it occurred in medical institutions. Most often, stigmatization occurs during the diagnostic process, a crucial stage for the entire treatment journey. Unfortunately, stigma does not stop here. 37% of doctors say they have been exposed to forms of stigmatization in medical institutions, in the community, or even within their families, sometimes simply because they work with people affected by TB. Recommendations to change their workplace, questions about whether they are afraid to come into contact with people with TB, and some even consider the profession to be inferior. These findings are concerning. In the 21st century, when effective treatment for tuberculosis exists, we can no longer blame people for becoming ill, and we cannot accept discrimination based on fear. That is why it is important to include modules on TB stigma and patients' rights in continuing education programs for healthcare workers. More information about TB-related stigma in the healthcare system and other settings can be found in our report published on the website.